Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the larynx. The larynx or voice box lies in the anterior midline of the neck in front of the third to sixth cervical vertebra. It is formed by the cartilages connected by ligaments, membrane, and has extrinsic and intrinsic muscles. It has three paired cartilages and three unpaired cartilages. Okay, so what are the unpaired cartilages? These are the large cartilages. We have the thyroid cartilage. This is the thyroid cartilage. It is lamina. Posteriorly, it is open. It has cornu, superior cornu, inferior cornu. We have the anteriorly. We have the Adam's apple or prominence here. We have the notch here anteriorly. Here is the prominence. Okay, and we have the lamina with the oblique line here. Here is the oblique line, and it is connected to the hyoid bone by means of the thyrohyoid ligament, and it is also articulated to that of the cricoid cartilage here. And the cricoid cartilage, this is a complete ring. It is a complete ring, and this is a hard structure. Actually, it is a heavy structure, thicker than that of the other cartilages, and it is a complete ring. Epiglottis, this is the epiglottis that extends from the base of the tongue to the vestibular fold of the larynx. We have paired cartilages, the arytenoid cartilages, corniculate cartilages, and the cuneiform cartilages. Arytenoid cartilages are present above the cricoid cartilage. It is not shown here. We'll see it very quickly. Corniculate cuneiform cartilages are present in the aryepiglottic folds. Okay. So if we go to the histology of the larynx, thyroid, cricoid, and basal part of the arytenoid cartilages are hyaline cartilages. So they will go through ossification. This is that start after 25 years, and by 65 years, most of them are ossified. All other cartilages are elastic cartilage. Suppose the epiglottis, arytenoid cartilage, the upper part, the corniculate cuneiform cartilages. Cricothyroid and cricoarytenoid joints are synovial joints. We have thyrohyoid membrane, and we have the artery vein passes through opening in the thyrohyoid membrane. That membrane is pierced by the internal laryngeal nerve and superior laryngeal vessel. You must remember that. So what structure pierces the thyrohyoid membrane? Conus elasticus. There is a cricobuccal membrane, hyoepiglottic ligament, cricotracheal ligament, and buccal ligament. Buccal ligament is elastic tissue, the medial free edge of the conus elasticus. Okay, so we have the thyroid cartilage, two lamina. This is one lamina here, on the other side another lamina. Anteriorly the lamina forms 90 to 120 degrees. 90 degrees in the male, in the female around 120 degrees. In case of male, by the action of the testosterone hormone, there are changes in the larynx structure and the pitch of the voice as the age appears around the adolescent period. There are some changes. Okay, so low pitch sound will happen, and there will be angle around 90 degree. In female, changes are less, around 120 degree. The right and left lamina fused anteriorly to form laryngeal prominence here. Okay, also called Adam's apple, and thyroid notch. This part is the thyroid notch. posterior borders are free and have superior and inferior horn. This is superior horn. This is the inferior horn. Superior horn has attachment to the thyroid membrane. Inferior horn help in articulation to that of the cricoid cartilage. We have oblique line here, very important, two muscle attachment. One is inferior constrictor of the pharynx, another is the thyroid membrane. Thyroid muscle, not membrane, thyroid muscle attachment to that here. Okay. So we got that. This is the lamina, left lamina on the other side, right lamina. This is the notch here, and this is laryngeal prominence here. The oblique line for the attachment of the inferior constrictor of the pharynx, and the thyroid muscle. Okay, and this is the site through which the thyroid cartilage attached to the articulated to the cricoid cartilage. Here we got that. And cricoid cartilage on the upper part of the cricoid cartilage posteriorly we have the arytenoid cartilage, pyramidal shaped cartilage, and it has at the apex of this pyramid we have the corniculate cartilage that is present in the aryepiglottic fold. We also get the cuneiform cartilage. It's a very small cartilages. This is the leaf shape or heart shape epiglottis. Okay, this forms the anterior boundary of the inlet of the larynx. It has some perforations and also location of the mucous glands here. This is the arytenoid cartilage, and it has the buccal process, and we have also muscular process here. Okay, at the base, apex is a site of articulation to that of the corniculate cartilage. Okay, so we got cricoid cartilage, a complete ring below the thyroid cartilage, has narrow anterior part and broad posterior part, articulates with the arytenoid and thyroid cartilages. Arytenoid cartilage, pyramidal shape, lying on the upper border of the cricoid cartilage. This lies on the upper border of the cricoid cartilage. Apex articulates with that of the corniculate cartilage. Base has a buccal process and the muscular process. We have the buccal process and the muscular process. Cavity of the larynx is very important to us. Cavity of the larynx, we have the inlet or editors to the larynx. Then we have the vestibular fold. The gap between the vestibular fold is called rima vestibuli. Vestibular folds are also called false vocal cord. Then we'll get the sinus of the ventricle. Okay, sinus of the ventricle between the vestibular fold and the vocal fold. Okay, sinus has a pocket-like extension. We call it saccule that contains some mucous gland that continuously lubricating the vocal folds. Okay, this is the infraglottic part of the larynx. Then it is continued as the trachea. Okay, we got that. Here we got the sinus here, and if you pass your probe, you'll get the saccule, a pocket extension of the sinus. Here, this is the epiglottis, and that is the hyoepiglottic fold connecting the epiglottis to the hyoid bone here. Okay, here we have also connection of the epiglottis to the thyroid cartilage here. Okay, so these are the images with the buccal folds by the action of the muscle. They may be closed, they may be open, they may be adducted, they may be abducted. So you got vestibular fold here, we got the vocal fold here. These are the vocal folds. Rima vestibuli, between the gap between the vestibular fold. Rima glottitis, the gap between the vocal folds. Three parts of the cavity. One is the vestibule that is starting here, sinus here, and sinus is extension, that is the saccule, and this is the infraglottic part of the larynx. So these are the features we'll see through the laryngoscope. Okay, laryngeal inlet will go to the vestibule, the vocal cords. Vocal cords by laryngoscopes, its appearance is very much pearly white color, okay, in a healthy person. So we have muscles, we have the intrinsic muscles and extrinsic muscle. Okay, so we have multiple extrinsic and intrinsic muscle, and we got thyroepiglottic muscle, thyroid muscle, lateral cricoarytenoid muscle here, oblique arytenoid, transverse arytenoid muscle. We have this is the intrinsic muscle, this is the cricothyroid muscle, posterior cricoarytenoid muscle. These all are intrinsic muscles. Okay, so we'll get the action of the muscles, intrinsic muscle, mostly cricothyroid. It tightens the vocal cord. Vocalis also tightens the vocal cord. Thyroidenoid, adducts, that means it make close together. Adducts, the vocal folds, also transverse arytenoid. And effect on the rima glottitis, it closes because it adducts. Posterior cricoarytenoid, abduct, separate out, and the rima glottitis is open here, abducts. And lateral cricoarytenoid, it closes, it adducts the vocal folds. Here we are getting the nerve supply of the larynx. These are the branches of the vagus nerve, the superior laryngeal nerve, from the inferior vagal ganglion. We have the internal laryngeal nerve here that penetrate the thyrohyoid membrane. We have also innervation by means of the recurrent laryngeal nerve. Recurrent laryngeal nerve turning around the arch of the aorta on the left side, turning around the right subclavian artery on the right side. This is the recurrent laryngeal nerve. This is the external laryngeal nerve, supplies the muscle, the cricothyroid muscle. Internal laryngeal nerve get inside and provide sensory innervation above the vocal cord. So these are, all of them are branches of the vagus nerve. Okay, so we got the cavity, we have the supraglottic part, we have the transglottic space or the sinus, and we have the subglottic space here. This is the sinus, this is the supraglottic part. Okay, extend from laryngeal inlet to the vestibular fold, the supraglottic part. Then between the vestibular fold and vocal fold, we have the sinus. Then below the vocal fold, we have the infraglottic part. Okay, we got that. We are looking at the thyrohyoid membrane, what structure pierces it, the superior laryngeal artery, and the internal laryngeal nerve. Okay, this is the cricothyroid. What is its nerve supply? The external laryngeal nerve. Okay, then we have the recurrent laryngeal nerve. Recurrent laryngeal nerve should innervate all the intrinsic muscles of the larynx, plus the infraglottic part of the mucosa inside the larynx. Blood supply, nerve supply, and lymphatic drainage. Okay, blood supply above the vocal cord, superior laryngeal artery and superior laryngeal vein. Superior laryngeal artery is a branch of superior thyroid artery. Superior thyroid artery is a branch of the external carotid artery. Superior laryngeal vein would open into the internal jugular vein. Below the vocal cord, inferior laryngeal artery and inferior laryngeal vein. Inferior laryngeal artery is a branch of the inferior thyroid artery. Inferior thyroid artery is a branch of the thyrocervical trunk. Thyrocervical trunk is a branch of the subclavian artery. Inferior laryngeal vein will open into the left brachiocephalic vein. Nerve supply will give emphasis to the intrinsic muscle. We must remember the nerve supply. It is easy to remember. To the muscles, certainly these are motor. All the intrinsic muscles of the larynx are innervated by the recurrent laryngeal nerve, except the cricothyroid, which is innervated by the external laryngeal nerve. This is very important. All the intrinsic muscles of larynx are innervated by the recurrent laryngeal nerve. Recurrent laryngeal nerve has recurrent course around the arch of the aorta. For the left recurrent laryngeal nerve, it is recurrent course around the right subclavian artery on the right side. Okay, they supply the intrinsic muscles. Sensory innervation above the vocal fold, internal laryngeal nerve. Below the vocal fold, recurrent laryngeal nerve. How about the vocal fold? Vocal fold get sensory innervation from both internal laryngeal nerve and recurrent laryngeal nerve. Lymphatic drainage, deep cervical lymph node. It follows the blood vessels. So upper part above the vocal cord go to the anterosuperior group of deep cervical lymph node. Lower to the vocal fold, the lymphatics goes to the posterior inferior deep cervical lymph nodes. Okay, we have some clinical note. Age changes in the larynx, as I mentioned. Hyaline cartilage will be ossified. The ossification begins after 25 years. By 65, thyroid, cricoid, and the basal part of the arytenoid cartilage become ossified. Cancer of the larynx is very common condition, especially to the tobacco users. It is a site of cancer, and laryngeal cancer follow the lymphatics. There will be pretracheal, paratracheal, deep cervical lymph node enlargement. Foreign body infection is very much possible, especially damage to the internal laryngeal nerve. Then the vocal cord and vestibular fold, the reflex mechanism would not close the vocal folds, so that the foreign body will push down. Okay. Needle cricothyrotomy that may be required. Sometimes food may go into the larynx. Then in emergency situation, just a needle, a wide bore needle through the cricothyroid membrane anteriorly between the cricoid cartilage, the thyroid cartilage, that can save life. Then there will be good surgical cricothyrotomy in an emergency room. But this just wide bore needle can save life in case of choking. Singer's node that may happen due to overuse of the vocal cord. Also we call it teacher's node. Too much talk by the teacher that may changes the lining epithelium of the vocal cord. Okay. By the way, the lining epithelium of the larynx is mostly ciliated, columnar, pseudostratified like that of other respiratory system. Okay. But the area of the vocal cord where there is friction, it is stratified squamous epithelium. Certainly it is covered by mucosa from the saccule, from the sinus of the larynx. And the epiglottis anteriorly, it is mostly stratified squamous epithelium. Even the upper part of the posterior aspect, stratified squamous epithelium, other part is the ciliated columnar epithelium, like other part of the upper respiratory tract. Okay, so that's all about the anatomy of the larynx. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me. Have a nice day. Bye now.